Well, welcome everybody to the Behind Berwick podcast. And today I'm really excited to be joined by two really special colleagues who play a massive part in providing patient care from Berwick Infirmary. So we're joined by Anna and we're joined by Dr. John Adamson. So if I can start with you, Anna, so can you introduce yourself and just explain your role?
So my role, it's about supporting the nursing team to effectively do their role. So we're looking at standards, looking at the services that we provide. Can we do it safely? What other things can we provide? Looking at patient pathways and looking how patients are transferred back to us from other sites, looking at getting them rehabilitated and then discharged.
Because the patients that we care for, Anna, can you just explain what type of patients we look after?
We've got one ward that looks after care of the elderly patients, and patients may go into NSEC and with an acute illness, they're stabilised, and then they'll move through our system, come back to Berwick for rehabilitation, and we will support that.
So people who don't know, N6 are emergency hospital.
It's an emergency hospital, yes.
Now, Anna, you've been here a long time. Will you tell us how long you've been here?
I started in the trust in 1987 and just worked around, worked between Alnwick, worked between Berwick, back to Berwick again. And worked in different areas throughout the hospital.
40 years, Anna, if I've done my maths right. 80s, wow, that's incredible. Now, moving on to you, Dr. Adamson, can you introduce yourself and just explain your role?
Yes, I'm John Adamson, a consultant physician. I specialise in elderly medicine, and I come up to Berwick twice a week, mainly to work on the ward. I do ward rounds there, and also have a clinic that runs once a week, and also liaise with the day hospital, sort of prescribing infusions and things like that.
Yeah. So do you work in other hospitals in the trust then?
Yeah, so I work across sites in the trust. So I do my on-calls in Cramlington, and my base is at Wansbeck, and I'm in charge of one of the elderly medicine wards there. And as I said, I also come up to Berwick twice a week, and I also have Parkinson's clinics in the area, so Berwick, Alnwick and Rothbury, but also North Tyneside.
Right, and how do you enjoy that, travelling around and getting to work at different sites?
Yes, actually that's part of the positive side of the job plan, is being able to go from one place to another. I enjoy driving and I love the scenery in the northeast. I find it a nice challenge to work in different scenarios and different teams.
Yeah, absolutely. So elderly medicine, Dr. Adamson, you touched on there that you work with patients who have Parkinson's, but what other conditions do people present with?
So basically, as Anna said previously, here in Berwick, the ward is mainly a rehabilitation ward, but we also look after patients who are unwell and approaching end of life in a palliative approach. And in clinic is more generic, but lots of patients present with frailty or have specific problems, so we look at that.
And I suppose your role, Dr. Adamson, you couldn't do what you do without Anna and her team and vice versa. What about you, Anna? Do you work well with Dr. Adamson?
I would like to think so. We've worked a few years, we do, don't we?
Yeah.
We do, yes, we do. I do. Yeah, and I think the team, I think Berwick, it does have a very community-based feeling. The staff all work for each other. They'll support each other if there's shortages around different departments. Staff are always there to help.
So Anna, just thinking about your role and kind of, everybody in the hospital, I mean, from, we've spoken to quite a few people, from cleaners to nutritionists to the cook, and everybody has an impact on patient experience.
Definitely.
So what is your favourite part of your role? What gives you that real kind of sense of achievement?
I was going to say, when we get it right. I mean, I think it's, if you're having a bad day, or you feel you've got a bad day and you come in and somebody just makes you smile and just puts you back to reality, and it's, everybody just does get on. And it is like, it's kind of cliche saying it's like a family. It's not like a family, but, they'll all work for each other and they'll all just support each other as a team. And that's whether it's the ward, whether it's in minor injuries or outpatients, You know, if there's a problem and a real problem going on, everybody will try hard to try and solve that. But that'll go with the porters and, you know, they just work all gel together.
You do really get that feeling when you come in the building. What about you, Dr. Adamson? What would you say gets you out of bed in the morning? Why do you love coming to Berwick?
Well, I love my job generally, so I really enjoy medicine, and I feel it's a daily challenge. We never really know what to expect that day, and it's a job where we can really help people. And I think working across sites, one of my challenges is to try to deliver the same level of care, whether it's at Cramlington in an acute setting or here in Berwick or at Wansbeck. So that's what I try, delivering the same sort of care no matter what ward you're on.
Well, that must be a challenge, because if you walk into Cramlington and you walk into this hospital, totally different environment, totally different setup. So that must be quite a challenge for you.
So it is very different, and in a way in Cramlington you might see patients who are more unwell, but you have a massive team supporting. So one has to adapt and sort of try doing one's best in each site, and that's why it's so important to work closely with a team, especially when one's further away from the central hospital.
Yeah. So sitting in our current Berwick Infirmary, it's a really old building, lots of history, you know, the look and feel, it's Victorian. There's a lot of memories in these walls. So Anna, have you got a couple or one really memorable moment that when we move out of this building and we go into our new hospital, you think, I'll always remember that?
I can always remember why I wanted to be a nurse, and it was because my gran was a patient in here, in one of the wards. It has been demolished, but that was one of the reasons why. It was because of coming in, and I used to come in and feed her and help look after her and sit with her. And I can always remember when it was a time to die, at that point in time, many, many years ago, I was asked to, and I was only about 13, I was asked to go away. And, you know, by the time I got home, she'd passed, and it was always something they remembered with us and said I would never, ever let anybody who didn't have any family with them pass away on their own, as long as I was, you know, if I was on shift. And that was one thing that's always stuck with us.
Yeah. And how have you carried that through?
No, I've done, well, I have, I've done that when I've been nursing, like as a nurse on the ward or being a manager. You know, always made sure that there was somebody with somebody if they didn't have a family member there until the family member came. And that was one thing that I always reminded us why I wanted to be a nurse, and one of the things. And I think the hospital does have history. You know, it's a community hospital. People come in. You know, you have good things, you have bad things. You know, family members have been here.
Yeah, because Berwick's a very close community.
It is a close community, and you do know. You know, people will come in and you know them, or they know your family, and they know who you are.
Yeah. What about for you, Dr. Adamson? What about a memory that you'll take from this building with you?
Yeah. I don't think there's a specific memory in itself, but certainly I feel that the building sort of denotes a long tradition and history. So even though we'll have a brand new build, I think it's important to take the sort of continuity and stability and that sort of thing that keeps on. And as Anna was saying, one can go back decades and decades, and there's always been care here to try to sort of keep the values of that ongoing.
Mm-hmm. So when we step outside this building now, there is a huge building being built, and we've got the structures up, the cladding's starting to go up, the roof's on. How does it feel for you, Dr. Adamson, when you look at that and you think, wow, I'm going to be delivering care in that building? How does it make you feel?
Well, I think it's inspiring, really. I see the changes week by week because I have my office there in the clinic and I can see the building. So it's something that changes week by week. It's positive, it's moving forwards, and it's going to be a great new build. It'll be brighter and large, and I think one of the nicer things will be that it'll integrate primary and secondary care. So I think there's a lot of positivity in a year that's been quite challenging for the NHS. So it's good to see all these positive things going on.
Yeah, absolutely. So for people who don't know, we've got a GP surgery, haven't we, well close, and they're going to move into the hospital building, and that's got to streamline things. But just thinking about if one of your patients that you see now is listening to you, and they're feeling maybe a little bit apprehensive about, oh, you know, I've seen Dr. Adamson in that room, in that hospital for so. What would you say to them? What would you say to reassure them about the care that they're going to get in the new building?
Yes, if anything, the care will be similar or improved, as it'll be a very nice environment. And actually, when patients come to clinic, I usually show them the new hospital, and they're all quite sort of see it as a very positive thing.
Yeah. What about you, Anna? How are you feeling about?
I'm excited. It's been a long time coming for a lot of us, and we've worked in the hospital over the years alongside the builders, where we've moved departments to allow for the build to progress. And I think getting into the hospital, it'll be like a breath of fresh air for all of us. Although you have your memories here, we're going to something new, something open, something airy, something modern that's going to take us 50 plus years down the line as a building. And it does look big compared to where we are now, but then our hospital here was sprawled over a big site. But we're also going to be having district nurses in here, GPs, surgeries coming in here. So there's more things coming into the hospital.
And if we can just focus, really, both of you to answer, just thinking about the services. Now, when we go out and talking to the community in Berwick, that is obviously their main priority. They want to know what's going to be in our new hospital, and we're bringing new services in, aren't we?
We've got, well, obviously our theatres are coming back, so our endoscopy is coming back to us. We've got, outpatients. We've got our district nurses that are coming into the hospital to do district nursing clinics here. We're looking at DEXA scanners. So instead of patients, maybe if they've had a fracture and they meet the criteria, they've got to go and have some scans done to look for osteoporosis. Instead of having to travel to North Tyneside, we're looking to bring in that into Berwick. And really we're kind of working to see, what can we deliver here safely? It has to be safely. And we do understand that some people have to travel for certain tests or certain treatments. But what we can do safely, we will always try to bring it back into Berwick and look to see, does staff need to have extra training? We do a lot of work with our medical day unit where people can come in for the day and have treatments done, which maybe you don't have to go down to NSEC for. And sort of like our NSEC, our ambulatory care down there, will sometimes refer patients up here to finish off the treatments, so they don't necessarily have to be travelling. So we are looking at things like that.
Yeah, and having new services sort of around you, Dr. Adamson, I'm sure you've been involved in all of those discussions over a long period of time about what we can additionally deliver from here safely. How do you feel about that, being able to do new treatments and new care?
Yeah, I think it's positive, as Anna was saying, patients who are on infusions and that, having them here locally avoids them having to go down to Newcastle on a regular basis. So we liaise very closely with the day hospital.
So when you talk about infusions, just explain what...
So these are infusions for neurological conditions such as multiple sclerosis or rheumatological infusions. Also, if one's anemic, one can benefit from iron infusions or blood transfusion. So all that's coordinated via the day hospital with different teams, be it rheumatologist, hematologist or myself.
Yeah, absolutely. Now, you mentioned before, Dr. Adamson, that you work with Parkinson's patients, and that's an area that's kind of very high profile in the media, and the politicians, they're always talking about it. That must be an incredible thing to work with a patient and to make their life better.
Yes, I think Parkinson's obviously is a large spectrum, and one needs to support each patient individually throughout their condition. And we always continue reviewing patients, so we never discharge them from clinic. So once a diagnosis is made, they now have the support of the team, and it is a wider team. There's a nurse helpline that patients can access every day, and they'll always speak to a specialist Parkinson's nurse and then liaise with ourselves. So it's sort of comprehensive support throughout.
Yeah, great. So Anna's touched on why she wants to become a nurse. Why did you want to do what you're doing? What inspired you?
So since the age about 11, I decided I wanted to be a doctor.
Right.
And partly it's influenced because I was born when I was just 6 months old.
Right.
So I spent a month in intensive care and survived. So I think that's sort of what inspired me to do medicine.
Oh, how lovely. Where were you born, Dr. Adamson?
I'm Argentina. I was born
Right,
in
okay.
Buenos Aires.
Oh, wow.
Yeah,
That's
and I came over in 2005.
right. And do you like the Northeast?
Yes, actually, it's by chance I was doing a postgraduate course in Geneva, well, near Geneva in Switzerland, and I met a geriatrician from the Northeast, and that's how I sort of sat for the exams and then came for my first interview.
Oh, fabulous. Oh, Northeast is a fab place to live and work. So, to finish off, I just want you to think, when you're thinking about our new hospital, 3 words that come to mind straight away. Anna, we'll start with you. Our new hospital.
Excited. Excited.
And what about Dr. Adamson?
Yes, I think it's really positive in sort of a year has been hard for the NHS, so it's good to show positive aspects. It'll be good for the patients, and I think really we need a new hospital as we go changing techniques and that technology. We should also upgrade the buildings accordingly. So it'll be really positive, and it looks large, it'll be bright and have a environment that's friendly for patients, including those who have dementia, for example.
Yeah. Well, it's been absolutely brilliant speaking to both of you, just to get a little snippet of insight into your kind of, I suppose, your professional careers. Thank you very much.